Hello friends, welcome back to Shiji classes, and in this video we are going to discuss on Lincoasmide antibiotics. First of all, the drug is clindamycin here. It is a chlorinated lincosamide antibiotic. Now we will discuss the mechanism of action of clindamycin. Clindamycin binds to the 50S ribosomal subunit and inhibits the translocation and thus inhibits the bacterial protein synthesis, and hence the clindamycin is known as bacteriostatic. Here you have to remember that it inhibits the translocation step. Next we will discuss the mechanism of resistance to clindamycin. Modification of the ribosomal binding site by the constitutive methylase enzyme confers resistance to clindamycin and also to the erythromycin, but not the inducible methylase enzyme. So students, the antibiotic efflux is not an important mechanism of clindamycin resistance. Now you have to remember here that the constitutive methylase enzyme confers the resistance to clindamycin and not the inducible methylase enzyme. Now we will discuss the antibacterial spectrum covered by clindamycin. It is highly active against the gram-positive cocci. That includes streptococci, penicillinase producing staph, but not the MRSA, Corynebacterium diphtheria, Nocardia, Actinomyces, Toxoplasma and Plasmodia. It has also high activity on the anaerobes like Bacteroides fragilis, Propionibacterium acnes and Clostridium perfringens. But it is not active against aerobic gram-negative bacilli, enterococci, spirochetes, chlamydia, mycoplasma and rickettsia. Students, here you have to remember that it includes the gram-positive cocci and also the anaerobes. These 2 points you should have to remember. Now we will discuss the pharmacokinetics of clindamycin. It has good oral absorption. It penetrates into most skeletal and soft tissues, but it does not penetrate into the brain and CSF. It accumulates in the neutrophils and the macrophages. It is largely metabolized. The metabolites are excreted in the urine and bile. T-half is 3 hours. The dose is 150 to 300 mg QID oral. Now we will discuss the side effects. Skin rashes, urticaria, abdominal pain, and a high risk of a superinfection known as pseudomembranous colitis. It is also called the antibiotic associated colitis or the Clostridium difficile colitis because it is caused by Clostridium difficile organism. The diarrhea with blood and mucus in the stool is the characteristic of it. The drug of choice for the pseudomembranous colitis is oral vancomycin. Alternatively, oral fidaxomicin or metronidazole can be used. The oral fidaxomicin is an RNA polymerase inhibitor. Next, the liver damage is occasional. Thrombophlebitis on the IV administration can occur, and it also blocks the neuromuscular conduction, and hence it worsens the myasthenia gravis. Here I would like to ask a question that the drugs which causes the neuromuscular conduction includes what? Please write in the comment section. And also remember that the pseudomembranous colitis can also be caused by third generation cephalosporins, broad spectrum penicillin and fluoroquinolones including the clindamycin. Next we will discuss the uses of clindamycin. Here I have drawn a table differentiating the organism, infection, and the treatment. First, Toxoplasma gondii. It causes toxoplasmosis in the AIDS patient. The treatment here is clindamycin with pyrimethamine. Next, Pneumocystis jirovecii. It causes Pneumocystis jirovecii pneumonia, that is PCP. But the PCP here stands for Pneumocystis carinii pneumonia. But instead of carinii, jirovecii is written. The treatment for PCP is clindamycin with primaquine. Next, Propionibacterium acnes. It causes infected acne vulgaris. The treatment here is 1% Clinda gel. The P. falciparum causes multi-drug resistant falciparum malaria. The treatment here is quinine or artesunate along with doxycycline. Alternative to doxycycline, clindamycin can be used. Next, Clostridium perfringens. It causes gas gangrene. The treatment is clindamycin along with penicillin G. Bacteroides fragilis causes peritonitis and pelvic infection. Treatment here is metronidazole or the beta-lactam antibiotics. Clindamycin has low susceptibility, hence it is not mostly preferred. Now we will discuss the further uses. Prevotella bacteria or the Fusobacterium causes peridental or lung abscess. The treatment here is clindamycin or beta-lactam antibiotics. Staph aureus or group Streptococcus produces the toxins and hence causes toxic shock syndrome. Clindamycin and vancomycin is the treatment. The clindamycin decreases the toxin production in the gram-positive bacteria. Next, Staphylococcus. It causes osteomyelitis and the treatment is clindamycin. Clindamycin is used as because it has good penetration in the bone. Last one is Babesia. It causes babesiosis. In the severe case, quinine along with clindamycin is used. So, in the mild and moderate case, the azithromycin and the atavaquone is used. Next, we will discuss the prophylaxis. So, clindamycin is used for the prophylaxis of endocarditis in the penicillin allergic patients with valvular defects who undergo dental surgery, and also it is used to prevent the surgical site infection in the colorectal or pelvic surgery. So this is enough. Thank you students for watching this. Please do like, share and subscribe. And students, if you like this PowerPoint presentation, then let me know in the comment section. Thanks for watching.